Okay, so my clinical question was, in a 68-year-old female presenting with type 2 diabetes mellitus and diabetic peripheral neuropathy, is gabapentin or pregabalin more effective at improving the pain symptoms associated with the diabetic peripheral neuropathy? So the case study that I actually chose was in the primary care setting. Is a 68-year-old obese African-American female with past medical history of type 2 diabetes, hypertension, osteoporosis, osteoarthritis, and degenerative disc disease, who presented to clinic for routine follow-up. She basically reported that her numbness and tingling in her bilateral lower extremities was persistent and worse at night. She was currently taking gabapentin 100 milligrams 3 times a day, and it was not currently relieving her symptoms. So with this patient, for our plan for that particular complaint, we just decided to increase the gabapentin to 200 milligrams 3 times a day, so we doubled her dose to see if that would be more effective at improving her neuropathy symptoms. So that led me to my clinical question of comparison between the efficacy of gabapentin and pregabalin. And I found a research study that was a randomized controlled trial comparing gabapentin, duloxetine, and pregabalin over a 12-week treatment period. And it basically found that all the treatment groups displayed a significant reduction in pain symptoms at the end of the 12-week treatment period. However, there was no significant difference between the resulting improvement between groups. That being said, there was a significantly faster reduction in pain symptoms in the treatment group receiving the pregabalin compared to the other 2 groups. So therefore, the clinical conclusion and clinical bottom line from that study is that there is no significant difference in clinical efficacy between gabapentin and pregabalin for the treatment of diabetic peripheral neuropathy pain. However, pregabalin does provide faster onset of symptom relief.